So I'm just going to move us on maybe quickly and introduce our next two guest speakers who are from Malama Ikeola Health Center in Maui. Our first speaker is Dr. Malia Purdy. She's the Director of Programs at Malama Ikeola Health Center, which is a federally qualified health center in Maui. She earned her PhD in public health with a focus on translational research, emphasizing community-based participatory research, and holds a Master's of Public Health degree specializing in Native Hawaiian and Indigenous health. Malia's primary area of interest is community-driven programs as a mechanism to ensure and sustain interventions that are aimed to address the needs of the community. Her role at Malama Ikeola Health Center allows her to oversee cultural and community-driven initiatives like the CDC Pacific Islander Diabetes Prevention Program, helping to create sustainable partnerships with other organizations in the community, and delivering cultural onboarding training for newly hired providers who are not from Maui. Risa Yarborough is the program manager at Malama Ikeola Health Center. She primarily oversees the community health worker program there. She enjoys working with those that are passionate about serving the community and advocating for those that have difficulty navigating the healthcare system. She hopes that the community health worker program will entice patients to openly help and ask for help and any circumstances that affect their ability to manage their healthcare. So with that, I'll turn it over to Malia and Risa.
Thank you so much, Jen and Apjo, for inviting us to be part of this. And thank you so much, Dr. Trinidad, for your very comprehensive, I mean, you literally had to do so much work in so little time, and it's just amazing, you know, everything that that needed to get done. Very similar. I think what I'm gonna share is just gonna echo a lot of what he just said. So if we can advance one more time. I'm sharing considerations that happen in our administration very early on. So our chief medical officer is actually an infectious disease specialist. And so when this outbreak happened, had it not been for him, I don't know where we would have been, Dr. John Vaz, but he was just like, declutter everything. I feel like that was the first thing. He's like, all your work surfaces, put everything away. Nothing should be on your desk. We need to be sanitizing things. He moved very quickly, especially because the safety of our healthcare workers was the priority, right? A lot of people looked at the patient perspective and, you know, how do we cater to patients? But his whole thing was, no, our workforce is important, right? Like, how are we supposed to help our community if our workforce and our employees are being sick? So that was one of the very first things he did. Also, just Risa worked really diligently and hard on inventory for PPE. We needed to make sure that we had enough to keep our healthcare workers safe and protected from whatever, you know, they were thinking airborne, they were thinking droplet. There are so many iterations of what COVID-19 was. And so we really needed to know, okay, what are the supplies that we have in the clinic and what was that burn rate, right? Like if we were gonna operate normally, how many masks was each department using? How many sanitizers? How many wipes? So Risa's an inventory guru. She'll probably share that later on. And then the second thing he did was he immediately just created a COVID command center. And that included everyone from all parts of the clinic. So we had our CEO, we had our chief operating officer, we had the medical officer, we had the financial officer, we had our information technology and electronic health record person on board, me as community engagement. We just needed to know how this was affecting every single department that made the clinic run. And that was super helpful because we just heard concerns from every corner. And then when we needed more information from the clinical department specifically, we would invite them to be part of, you know, to join our meetings. Like dental, you know, like, hey, what is, you know, your dental association saying right now about this COVID, and did they give recommendations? So really, really hearing about how to continue to operate, because closing, was just not an option. And then that committee kind of morphed into the steering committee that's redesigning what it looks like now moving forward. Now that we have all these protocols in place, now that we have to incorporate social distancing, what is it going to look like to operate normally from here on out? So that was, kind of the administrative things. Human resources wise, we needed to implement policies. People, we have employees, once school was out and you have kids at home, if they can't stay home by themselves, like how do we accommodate our employees and still being able to keep a job, but also tend to their families? So there were just so many considerations and new policies that had to be written up that didn't exist before COVID. And there continues to evolve, like those policies that we created in the beginning have morphed many times based on the recommendations as Hawaii is opening up again, as there's more guidance, as we learn more about COVID-19. And we just had to be okay with, being flexible throughout navigating this COVID, new disease. In terms of workplace, so like I said, the declutter, disinfection protocols were being put in place. And then also in our administration, if you were admin and not really doing clinical work, you had to find, he paired everybody up and everyone would switch off taking days just so that there weren't as many people in the clinic at the same time. So if you were somebody in accounting who didn't have to be in the clinic to see a patient, you would only come in a couple times a week. Some people just went completely remote, working from home. Some people did a hybrid schedule where they just came in on like opposite days of their buddy. And it was purely so that we could practice social distancing and decrease contact in the clinic. And then workforce-wise, we had to repurpose a lot of things. For us, the Community Engagement Department, our CHWs who used to do home visits and homeless outreach, all of a sudden, all of that came to a stop. DPP, where we had classes, gatherings, that had to stop. Like all of our programs just came to a halt, and our entire department was repurposed to do other things that were of priority and that were of greater need. And I think that's a great segue to Risa, who is the manager of the CHWs. And her position alone, she doesn't do what she was hired to do because of COVID. And so I'll just let her talk a little bit about that experience.
Can you hear me?
Yes.
Okay. Hi, everyone. So kind of just continuing on with what Malia was saying, I'm not going to talk too much about in detail about policies and procedures that we kind of created. I actually really want to talk about your employee feelings because like Malia said, we're all doing work that we didn't necessarily sign up to do. And we really want to consider that, when we sign up to be healthcare workers, nobody expects to be a healthcare worker in a pandemic, right? So probably a really scary time for a lot of people, and especially for our department as well, who aren't necessarily medically trained staff. They're mostly just really great at working in their community and offering other services to our patients. So a little bit of the protocol changes that had to happen. Our community health workers were no longer able to conduct home visits. It was stopped pretty immediately. We found out on a Friday that as of Monday, no more home visits. So we definitely had to call all our patients and let them know your upcoming home visit is canceled until further notice, but to please call us if you need anything. We also had to come up with protocol for interpretation services. So our clinic was still very much open. And if anyone was sick, there was PPE precautions and kind of a protocol in place for the clinical staff, but no one had thought to put anything together for our interpreters. So we just kind of for the sake of keeping PPE burn rates at a minimum and keeping just the contact with sick patients between the provider and just the patient and the nurse, we actually stopped interpretation services in the clinic. Now, what that did was it didn't seem to affect our patients too much. What did affect our patients was not having interpretation services at their referral appointments with outside providers. So we've had patients really struggle with their health just because they couldn't have the language service that we normally offer. So that's something to consider. So we did start incorporating like telephone calls. So if the patient goes to another provider, they call our interpreter and the interpreter works with them over the phone, because other medical providers don't have a language line service that they utilize. And then our interpreters were still available for well child visits and regular routine adult care. We also did stop complementary therapy appointments. So we had patients going to massage therapy and acupuncture, and that came to a stop. We can go to the next slide. So they were repurposed for a couple of things, and actually I forgot one thing on here. So they were repurposed for entry screening. So basically anyone that came to the clinic, you could only come in if you had an appointment, and this was to eliminate unnecessary traffic through the clinic. So if you had an appointment, you would go through a series of questions, and those questions included if you traveled, if you've had a fever in the last 2 weeks, and if you've been tested for COVID-19. The screening questions, they changed kind of as direction kind of came out from CDC. So, I mean, we started with 3 questions and now it's up to almost 10 questions. We did get a lot of frustrated patients and, you know, just impatient patients, but we had to kind of just remind the staff, you know, your customer service skills are super important at this point. So, you know, reminding patients that we're doing this for their safety, other patient safety, and for the safety of our employees. So what we did see was the clinical staff is completely relying on the front entry screening to do a thorough screening of the patient prior to them being let in. And if they were sick, then they were roomed appropriately in a what do you call it? Designated respiratory room. They were roomed right away, and then that's when staff would know to use appropriate PPE when seeing the patient. So if a patient got through the screening process, you know, and ended up in the waiting room and then into a regular exam room, we've actually, because of that, we've had entire care teams have to go out on a 2-week quarantine. So super, super important that, you know, the entry, our staff understood that, you know, you have to be diligent in answering, asking the questions to the patients, making sure they know how to, they know what you're asking. So we did learn that a lot of patients didn't necessarily understand what it meant to have a fever. So if you asked, do you have a fever or did you have a fever in the last 2 weeks? The answer was no, but it was because, oh, I took Tylenol. Okay, so you had a fever, but you took Tylenol, and that's where our staff didn't know, because they're not medically or clinically trained, they didn't know how to interpret the answer. So, you know, we had to design the screening questions to sort of ask follow-up questions if you didn't understand what the answer to the initial question was. So just lots of training. And then there was a new protocol for drop-off and pickup of paperwork. So some of our departments, like our member services and our WIC department, did close down. They weren't really seeing people in person, but patients could pick up applications and drop off paperwork to that front screening table. Pharmacy pickups, if a patient was sick, we had to have a runner go to the pharmacy, sign for the patient's medication, and then bring it out to them. The patient wasn't allowed to come inside. And then we also, our community health workers did start doing food delivery. So our patients age 70 and over who are on Medicaid and uninsured, we generated a list of patients and made phone calls and found out who was in need of food. And so we did twice a week delivery of meals to that particular list of patients for the last 6 weeks. So challenges, a lot of challenges with all the changes. Oh, and I forgot to mention our staff also, 2 of our community health workers turned into telehealth coordinators. So they were in charge of scheduling telehealth appointments and also offering patients telehealth education, which means they would let the patient know what to expect for their telehealth appointment and also conduct a test run. So the patient knew how to get on to our telehealth platform and work out any technological issues prior to them seeing their provider. So challenges, we had one department doing 3 different jobs. So trying to manage schedules and their new job duties, so protocols for each job duty that we were assigned, telehealth, food delivery, and screening. Schedule adjustments, there were constant schedule adjustments being made. So normally we have, you know, consistent schedules, like some of us are 8 to 5, some of us are 9 to 6. But during COVID, we had to change the schedule so that we made sure that there was complete coverage from the opening to the closing of the clinic at the screening table. We also needed to incorporate a schedule for the telehealth coordinators to be available during open clinic hours as well. And then food delivery was kind of a half day. So that staff would rotate into the screening table, breaking for lunches, things like that. So schedule adjustments were a little bit tricky, but we kind of got them down now. But your staff for a little while, the schedules, you know, they change on I think I give out their schedules on Friday, and it starts on the Monday. So they really don't have a ton of notice. It's hard to plan life that way, but in the middle of a pandemic, you can't really plan life anyway. So it's communication is a challenge. We basically, it was text me for everything. If you can't find me, I'm running around the clinic somewhere, text me. If you need something from each other, text each other or call each other by phone because, you know, we're not all sitting at our computers. We're doing very different jobs. And then employee morale, that kind of went down a little bit, I would say. And it is difficult to keep up when, you know, people are going through other things besides changes at work, but also with their families at home. So the lessons we sort of learned through all of this is that, you know, as a manager, addressing your employees' concerns and fears are super necessary to like face head on, and you need to face it now. It's, you know, amongst everything else that we have going on, we have to be understanding that our staff and our employees also have the same amount of anxiety and feelings happening, and for our staff, because they're not clinically trained in a lot of things, there was a lot of fear about being out at the screening table and kind of being exposed, you know, without PPE. We wore cloth masks, but that was it. And for a little while, we didn't allow gloves because gloves were we didn't have a high stock of gloves. So until then, we didn't allow the front screening to wear gloves unless they were using a cleaning product. One thing that's important that we learned is to establish your communication protocols early on. So a lot of the protocols that you're going to make, you're going to have a lot of changes, but communicating with employees, like how and when, how will you be communicated with when we make changes. So for me, it was, I'll email you everything, and if I know you're not working that day to receive your email, you'll also get a text message from me. So for my staff, we all had a group message, and that's how I would kind of send updates. But the expectation was every day when you're in work, you're checking your email for all changes. Expectations, so super important to also go over what's expected of employees, because like I said, their jobs are completely different, right? And then as a manager, performing the new job duties with your staff is super important. So for myself, when we first got assigned to the screening table, I sat for every single shift, so that my staff would feel I'm not making them do something that I wouldn't do. A lot of times we delegate, but super important to consider that your employees are also going to want to see you doing the work too. Training might need to happen over a few sessions, so lots of new things that we weren't trained to do, or we didn't sign up to do. So the retention of what the employees learn when they're learning all about COVID, and then they're learning all about new procedures, and then new procedures for different departments that they have to remember. It's a lot to take in. So we meet weekly, and we go over any questions, and we review protocols weekly. Quality management, so important to sit and observe all the time to know, you know, so if there's a problem with patients kind of getting in the back and they weren't supposed to be there, they're supposed to be roomed because they should be a patient that staff need to take precautions with, how are they getting back there? And really the only way to find that out is to sit at the front screening table with your staff and hear how the questions are being asked, listen to how patients are answering it, and you know, make adjustments on our end to accommodate those patients that are either refusing to answer the questions or not answering them appropriately. So what we've kind of done, actually, and you never think to do this, but we're not really like, if you think about customer service jobs, you know, where we offer services, but we're not customer service. So small things like, you know, your speech, you know, how are you asking the question? So we did a little bit in one of our team meetings, we did some speech practice where, because your mouth is covered with a mask now, nobody can see your lips moving, and your voice is a bit muffled, especially when you're sitting outside at a screening table. We practiced enunciating all your words, speaking at a volume that people can hear you that doesn't sound offensive. and, you know, just doing small things like that with staff that help, you know, on the patient's end for them to really hear what you're asking. And then in the weekly meetings, so that's also how we address performance as well. So kind of things that we notice through the week, we just kind of go over how we can improve. Employees are allowed to bring up all of their concerns, like what patients are saying, any confusion that's happening, and that's really where we clarify all of it. Sorry, 15 minutes, done.
You're okay. Thanks so much, Risa. And I know Malia had to hop off the line, but I really appreciate you kind of talking a little bit more about the employee experience. We are hearing a lot about just concern for workforce and morale and things that can be done to support staff and continue to provide care during COVID-19. I know we're over time, but I do want to just really thank Dr. Trinidad, Malia, and Risa for taking the time. I know you all are still very busy managing care with patients to share these lessons learned tonight or today, and sorry, it's evening for me, and kind of talk a little bit more about what this new normal is. I do want to take, I think, for the little bit of time left, and thank you all for staying on, just to open up the lines for folks to ask any questions directly in the time remaining. I'll also just send a chat question to you all, but please go ahead and unmute yourselves if you have any questions for Dr. Trinidad and Risa. Or even if there are any comments or reflections that you all might be having, just having heard a lot of the information that was shared today. I don't know, folks I think we have folks on from Ibai, Chuk, and Koshrai. Any comments? Or any considerations you all might be having too in terms of your preparedness at your health centers?
Can I ask a question?
Yes, please.
Yeah, I want to ask Malia, have you opened up your dental services?
Risa, I don't know if you could answer. I think Malia maybe had
totally
to hop off.
That.
Yeah. Great.
Yeah, that's the most challenging.
We are not, we're only doing emergency procedures right now. We're trying to look into reopening, but the PPE is definitely the holdup. Dental precautions are a lot different from regular medical, the medical staff and the usage of PPE. So their burn rate for reopen, when we got the estimate from the dental director, was super high. I mean, it was like 100 procedure masks a day, you know, just to cover the N95. The N95s are only going to last them 2 months on a rotational basis. So we don't have enough N95s to replace theirs after 2 months, and the clinical staff. And as far as gowns, I mean, it was an outrageous amount if they had to switch between all patients. So we are not at full dental operations right now, and we are not sure when we'll be able to open them.
Because a lot of dental clinics here closed shops, and a lot of the, you know, there's no access for dental services, very limited at the moment. So we felt we really need to work on our dental services too. Yeah, but it's a lot challenging compared to regular medical consults. Yeah, like what I said, even the airflow needs to be regulated. You need this extra oral aerosol suction machine just to make sure the dentists are protected from aerosol generating procedures, like because there's symptomatic or pre-symptomatic disease transmission. So you really won't know if patient have, COVID or not.
Yeah.
Anyway, let's compare notes once you open.